morning, everyone. Welcome to the UBC Learning Circle, hosted by the Center for Excellence in Indigenous Health. I'm very excited, very happy to be joined today by Margot Pierce and Marion Gunter of the BCCDC and the FNHA, respectively, to open up a dialogue on the coronavirus situation as it currently afflicts our communities. Before we begin, I would like to acknowledge that I am joining you today from the traditional, ancestral, unceded, and unoccupied territories, territories of the Hunkaminam-speaking Musqueam people. I would also like to acknowledge the First Nations Health Authority for generously funding the UBC Learning Circle. So quickly, kind of before we begin, particularly for this subject, as it is so current, it is so contemporary, I would like to provide a trigger warning. If these sort of conversations are triggering for you, if they're scary to engage in, I can appreciate that. I would suggest that you please look to engage a support network of some kind. Either have an elder, a family member, a friend, or a counselor, whatever it is that you need. Please make sure that you're able to access those resources today as we move forward. So introductions. My name is Cole. I'm from the Chowthil First Nation. I'll be facilitating the session today. There are no other Learning Circle team members in the room. We're all practicing good self-isolation, but Cynthia, our production coordinator, and Kaylin, our program assistant, are both joining us online. So with that, I know we usually kind of kick off with introductions. It's a little bit weird, or not weird, but it is a unique situation in an online format. So I'm going to say, Margot, would you mind kicking us off? Introduce yourself a little bit.
Yeah, sure. Thank you, Cole, for showing up today at the at the Learning Circle and being there. And yeah, my name is Margot Pierce. I'm a postdoctoral fellow with BC Center for Disease Control in partnership with First Nations Health Authority. And I am originally from Treaty 3 territory, but I've been living here on the unceded traditional territories of the Coast Salish peoples, including Musqueam, Squamish, and Tsleil-Waututh nations since 1998, I think. So yeah, I'm a settler person, and I'm mostly involved in the world of hepatitis and HIV, but have certainly been trained in epidemiology and paying close attention to how things are unfolding in the world with COVID-19.
Great. Thank you. Marion?
Hi, everybody. My name is Marion. I'm the clinical nurse specialist for immunization with First Nations Health Authority, and I'm also working with the COVID response team. I've done communicable disease follow-up for many years with different health authority, and I'm currently on the Squamish, Musqueam, and Tsleil-Waututh unceded territory.
Great. Thank you very much. So I think just to value everybody's time here today, let's just jump right into it.
Okay, great.
Please.
Okay, so we'll just go to the next slide, please. Yeah, so I thank you, Cole and Marion, for also acknowledging the territory. I also wanted to quickly acknowledge the elders and the knowledge keepers and the leaders out there who are holding us all together in this stressful time. I'd also like to thank the Indigenous scholars, leaders, and experts in health protection here and around the world who are working so hard. You might hear my son in the background now and again, who is watching cartoons as we speak. So I also want to start off this talk by acknowledging that Indigenous people know and have always known how to protect the health of their peoples. That there are long histories of ways of being and doing that have addressed health challenges as they come up, that have supported community health and well-being. And that knowledge and that wisdom is still there, and it's held by knowledge keepers and elders. And so we have to do everything in our power to protect these most valuable members of our communities.
Mm-hmm.
On the next slide, please. So I'll just give you an overview of our talk today. Marion and I are going to be talking a little bit about pandemics and epidemics, about the social determinants of them, and community preparation and protection. And then we'll have a question and answer period, and also give you a slew of different resources that are available and very useful. I also want to say too that the bulk of what I'm going to be presenting today is coming from a very Western epidemiological understanding of disease, which is a really unbalanced way of presenting this information. It's so important that we continue to support Indigenous-led epidemiology and health protection measures, and that those should be at the forefront. And I hope, at least in the next while, that is also a focus of all of our work. So much of what I'm going to be, both of us will be talking about today are things that you perhaps have already learned before. So this might be just a refresher for many of you. I know for myself, though, it really helps to go back to basics because, you know, there's so much changing all the time, and it really helps to just be in those foundations of basic epidemiology. I also want to say too that First Nations Health Authority has excellent resources that are a result of community consultation, and again, we'll provide those near the end. So the next slide, please. So there are some really key messages that I hope that you can walk away with after this talk today. First of all, you know, the words pandemic, epidemic, outbreak, these are really loaded words that are really heavy, and they can instill a lot of fear in people. They can trigger a lot of feelings that are unpleasant, fear, hostility, and suspicion sometimes, and for some people can instill feelings of shame. So it's important that we really use these words very carefully, and to use always person-centered language, even when we're faced with a new disease that's really hard to pin down. I'll get into some of the consequences of language later on in this talk, including, you know, fear and stigma. But really, you know, the key message here is just to be careful in how we talk about things. Epidemics and pandemics literally happen every day on the earth all year long. They affect hundreds of millions of people every single day. And we've learned a lot from history, especially in the 21st century, and we're getting more and more sophisticated in the way that we respond to pandemics and epidemics. You know, right now there's concurrent epidemics and pandemics going on, like avian influenza, Lyme disease, Lassa fever, rabies. These are affecting people all over the world all the time. And so in the next you know, few slides, I'm going to go over some of these rather intense words and really try and get at their definition and what they really mean, so that we can use them in a way that is based in scientific work and facts. And I hope that with this presentation that you also walk away with some key messages around how to be prepared, both personally and in your community, and how to promote feelings of calm and caution at the same time. Next slide, please. So I'm going to get into some key terms here to help you understand the level of disease and what's happening in a current state of disease. Some diseases, I should say, are so rare that if just one single case was to come up, that it would warrant a full-scale epidemiological investigation. While other diseases occur so commonly that we really expect them to be happening, and only really like deviations from the norm would warrant an investigation. When we're talking about sporadic diseases, this refers to diseases that are happening infrequently and irregularly. That may lead to sort of a few cases popping up now and again. Classic examples of these are polio, tetanus, and you know, things like salmonella and such like that. So these happen just once in a while sporadically. Many cases, polio is a very good example of this because you know, most places in the world now, thanks to the tremendous efforts of vaccination programs, poliomyelitis is a pretty rare disease to occur. But recent events really tell us that, you know, the end of polio might be near, but it's not gone yet because it still occurs unexpectedly. And a case in point was in Tajikistan, which is a country bordering Afghanistan and China. where, you know, similar to other countries, they hadn't seen a case of polio in over 10 years, but in 2010, they had a sporadic outbreak of poliomyelitis that affected over 450 children. Next slide, please. So endemic is another term that we use, and it refers to a constant presence of, or a usual presence of a disease or an infectious agent in population in a specific geographic area. So this is a level of disease that's expected. It's not what's desired, because of course we always desire zero infectious diseases going on. But you know, sometimes despite all of our efforts, there is still an ongoing level of disease that is considered normal or endemic within a certain geographic area. And it's almost considered like a baseline level. And a very good example of this is hepatitis A in northern India, where contaminated drinking water is unfortunately the route in which hepatitis A is often transmitted. And it's such a pervasive public health problem that there's an expected baseline of hep A within northern India that is quite high, but it's considered sort of their regular occurrence of hep A. Next slide, please. Epidemic, a word that we're sort of becoming more used to now, it refers to an increase of a disease that's often very sudden or rapid, where the number of cases of a disease above what is usually expected in a population in an area is suddenly on the increase. Some of those key words that you hear there, like it's sudden, it's a rapid increase of number of cases. And an example of this is the Ebola epidemic in Western Africa, which was in Guinea, Liberia, and Sierra Leone in 2014, which was very much unlike the different localized outbreaks that were happening around the scene since 1976 when the disease was discovered. So instead of being restricted geographically, this one really seriously affected several different countries and spread actually into different continents, sparking, you know, worldwide alarm. I also want to say here that this is another example of where using language is really, really important, and being careful in how we use language. The Ebola River is in the Democratic Republic of the Congo, and it's an absolutely gorgeous river. And that the indigenous name for that river is called Legbala. It means white water. And sadly, because the disease was named after a geographic area, it's now kind of drawn a feeling of stigma and fear to that very name. And so again, it's so important that we're so careful in the way in which we talk about diseases. And unfortunately, it's maybe, I wish that they would change the name of this disease because it does cause a lot of fear and stigma for people in that area. Next slide, please. The term outbreak carries the same definition as epidemic, but it's used in more of a limited geographic area. So it's the same as an epidemic, but it's really supposed to be talked about when you're just speaking about one specific area. So a really good example of this is plague, which you might think is, you know, a relic of medieval times, but actually that's not the case. It has occurred as an outbreak in different areas over the years. And one of them, a major outbreak, happened in Madagascar in 2017, where at least 2,400 people had confirmed probable and suspected cases. And there were 209 deaths. And most were the fatal pneumonic type, which is transmissible from person to person, but there were also several hundred cases of bubonic plague as well. Next slide. And cluster. This refers to an aggregation of cases that are grouped in a place of time that are suspected to be greater than the number that are expected. So this is even when the expected number, you don't really know what the expected number is, but you think it's like, this is out of the ordinary. So in, you know, a great example of this was the 1854 cholera outbreak in London, the United Kingdom, which was really attributed to the dawn of epidemiology. So there was this guy named Jon Snow, not the Game of Thrones Jon Snow, but like this other old white guy in London, in the United Kingdom, who was noticing that there was a cholera outbreak happening in Soho, this neighborhood of London. And he started to map the different cases that were happening in the area in which people were living. And they were able to trace the source of this disease to a water pump in the middle of this community. And he very famously took the handle off the water pump so that people weren't able to take the water from that well anymore, and to stop the number of new infections that were happening. So this was a cluster of infections that were happening in this community that was outside of what was expected. Even though they don't really know what to expect, they can tell that it's something out of the norm. Next slide, please. Finally, we come to the word pandemic, which we're hearing now every day. It refers to an epidemic that has spread over several continents or countries, usually affecting a very large number of people. And a good example of this is HIV, which was officially discovered in 1983, but has now affected well over 70 million people worldwide in just 35 years. Next slide, please. So I just want to drive home the difference here between epidemics and pandemics. The key difference here is really important because, again, these words are so loaded. So an epidemic is an event in which a disease is really actively spreading. In contrast, when we're talking about pandemic, this is speaking about geography. This is about a disease that's affecting either a whole country or the whole world. In addition, from the epidemiological standpoint, terms like these will direct a public health response to better control and prevent the disease. So key here, again, coming back to language, is that epidemic is used to describe matters of health. But, you know, nowadays, in sort of the casual way in which we speak, sometimes the word epidemic is used really casually, like there's an epidemic of tantrums at the daycare, or there's an epidemic of hysteria, or of toilet paper buying, or something like that. And these usages aren't like inappropriate in a modern context, but it could cause a lot of confusion and concern. And so, you know, just again, thinking back to, you know, how we use language and the feelings that the language can trigger in people, is to just be a bit thoughtful in how we use these words. Also, you know, to think, you know, about the words we've been talking about is, you know, to use them carefully. So maybe a disease that you're speaking about, you should speak about it in terms of being endemic, or you should, or an outbreak rather than epidemic or pandemic. So just being cautious. I should also note here that the World Health Organization has a real stringent criteria for when an epidemic is to become or classified as a pandemic. And there's actually 6 stages in which a disease has to go for a pandemic to be announced, which would explain why it took a while for the World Health Organization to actually call COVID-19 a pandemic rather than an epidemic. Marianne, is there anything you wanted to say about that as well?
No, I mean, I think pandemics are not declared very often, as people are aware, and changing things to be called a pandemic doesn't necessarily change the course of the illness or the public health measures that are implemented. It just opens up some opportunities for different funding and different authority or powers for the governments to help to control and mitigate the disease.
Yeah, good point. It does like sort of trigger, you know, legal and financial responses for sure. Good point. So next slide, please. So I'm just going to speak now about some key tools that can be used to understand epidemics. And you might be hearing more about these tools in the news or in, you know, other meetings that you're attending. One of them is the epidemic curve, or the EPI curve. It's a visual display of the onset of illness amongst cases that are associated with an outbreak. The EPI curve is represented by a graph with two axes at right angles. So the horizontal axis along the bottom is the date or the time of illness onset amongst cases. And then the vertical axis, or the y-axis, is the number of cases that are happening. And so you can learn a lot about an outbreak from an EPI curve. You can learn about, for example, an outlier. So for example, if a case of an illness happens at a time that you're really not expecting, this would help you determine whether or not you're seeing something out of the ordinary. It can also tell you the time trend of an outbreak, so it'll tell you the distribution of cases over time. It might also give you a general sense of the magnitude of an outbreak. So are we seeing a whole lot of cases or just a few? And it'll help you make inferences about the spread of disease. So are cases still rising? Are we seeing a peak yet? Are they starting to fall? Does it appear that the outbreak might be over? It could also tell you a little bit about the time of exposure. So for example, if we see a case happen of a disease that we know something about, and we know, let's say that it takes a week for symptoms to emerge, that we would be able to say, okay, this person was likely exposed about a week before, and so we can try to time things along the EPI curve that way. This EPI curve can be used for all kinds of disease spread. So you can look at this for a cluster or a sporadic event. You can use it for a full-on epidemic or pandemic. They're very useful to just try to get an understanding of what's happening. Next slide, please. So you might have heard people talking about the importance of flattening the curve. And this is about talking about implementing public health measures to contain the COVID-19 pandemic. And it's something that's been used for a long, long time in controlling all kinds of pandemics and epidemics. One thing to know about epidemics in general is that they have a real natural cycle, like a wave. So they'll start small, and then they'll build and build and build, and then they'll peak, and then eventually they'll start to fall. And this is because perhaps fewer people in a community are susceptible to the disease, or you know, that there's just a natural cycle to how many people are being infected. Maybe there's a number of people who are vaccinated and not vulnerable, or perhaps the disease just runs its course through a population. The ideal goal in fighting an epidemic or a pandemic is to completely halt the spread, but of course this is very, very challenging. And so instead we focus on slowing it down and mitigation efforts that are used, so like public health efforts, so we can get you know, time so that we can, say, develop an effective vaccine or implement other measures to protect people. Mitigation efforts reduce the number of cases that are active at a given time, which in turn then gives doctors and hospitals and schools and actually vaccine manufacturers and treatment developers time to prepare and respond without getting overwhelmed. So slowing the spread of that tidal wave of disease will actually save lives. It'll flatten the curve and hopefully keep society going. One thing that's really important to note here is whether you're looking at the red curve, which is a real sudden increase in the number of people who are infected, or you're looking at the blue curve, which is much lower and slower number of people who are getting infected, we're looking at about the same number of people. It's just one is more dense in the front and one is spread out over time. So, you know, the red curve is showing we have a fast number of people who are getting infected. The blue one is a slower number of people who are getting infected over time. So keeping that curve down and flat underneath the dotted line of the health system capacity prevents overtaxing our healthcare system and our resources, so that we can hopefully treat people and do a better job of taking care of each other as more and more cases emerge. Next slide, please. So just to drive home these ideas, flattening the curve is about why, you know, those earlier countermeasures are so important in an epidemic. Their intention is to lower the rate of infection so that the epidemic is spread out over a longer period of time, so that peak demand on the healthcare system is lower. Containment measures are then intended to avoid an outbreak trajectory in which a large number of people get sick at the very same time, which our health system just simply isn't designed to manage. And so then thinking about how we flatten the curve, well, this can be, you know, at the person level, where we're all asked to be, you know, calm and cautious, taking that social distance, washing hands, not touching our faces, and staying home if we're sick. And then on the government level, they're doing, you know, testing of people who are showing symptoms, especially people who are vulnerable, limiting gatherings and travel, and of course, tracking infections. Marian, did you want to say anything on that one?
Yeah, hi everybody. I think it's just also important to know that a lot of the public health measures that are being put in place now are for to help to mitigate that curve and the quick spike in a curve. That's what we're trying to avoid. So a lot of the measures are for population health, that we don't want to see this spreading across, but it is difficult because it's on an individual basis that the ask is being made. So, and a lot of the like changes to the hospitals, I think people heard in the news that the elective surgeries and things like that are being canceled. And that's to increase the capacity of the healthcare system to also help mitigate that and make space for ill people. The social distancing will help to flatten that curve, and it's really important we do that. It may go on for a while because the entire population is susceptible to COVID. So we actually want to be in this new normal for quite some time so that we can limit the number of cases that and the speed at which they come in.
Thanks for that, Marian. You know, on a like an anecdotal note, I find like on a personal level, I'm being more cautious. I don't want to accidentally like twist my ankle or, you know, have to go to the hospital for any reason. So I'm just being a little bit more cautious in my everyday life as well. And I think that what you're saying really speaks to that too, is that just trying to reduce any reason why I would need to see medical attention, unless of course I was very, very ill, then of course you should go see medical attention. Yeah.
Thank you both very much. I had a quick question regarding the EPI curve, if you wouldn't mind. So we're looking at flattening the curve in this instance. So my question is, why does the curve fall off? Is that and is that at all dependent on a risk of reinfection for a disease?
Yeah, good question, Cole. So you're right, it does. I mean, it can have to do with reinfection. In the most, like, let's say we have a very aggressive disease, such as Ebola virus or something like that. This disease has like a 40 to 50% fatality ratio. So as more and more people pass away, there are less people in the population who can get infected. And so you would see a natural die-off of the epidemic because there's less people getting infected. So the curve will start to fall. In the case of HIV, for example, we have done great efforts to try and get people who are living with HIV on antiviral therapies that suppress their viral load to zero. And so, you know, because of that, we're seeing fewer and fewer people becoming infected with HIV. And because there's a lot of other public health efforts as well in harm reduction and awareness and testing. So, you know, we're seeing a naturally declining curve in the HIV epidemic as well. So that would be the reason why. I mean, naturally, there are people who can become reinfected after they've been cured from a disease. So, for example, with hepatitis C, you can get cured from hep C, but you can get it again. And so there has to be extra effort to try and prevent reinfection as well.
Right.
Yeah.
Okay. And then I notice here at the government level, one of the ways that we can flatten the curve is to test people who are showing symptoms. And it seems like we're being very specific or strict as to who we are testing right now. Do you guys have any idea why that would be the case?
Yeah, I think some of it is ability to do the testing. Our labs are becoming overwhelmed with
Right.
tests. There's so many tests being done. A lot of them are negative results. We do have other respiratory conditions floating around, but I think once it's in the community and you know what the symptoms are, you don't necessarily need to test everybody. By testing everybody, it means they generally have to go somewhere or be in contact with other people to get that testing done, which has its own risks as well in terms of spread. Again, the majority of folks with COVID have mild symptoms, but the reason why we need them to stay is they're also transmitting disease, and we want them to stay away from the vulnerable. We really need to protect our vulnerable. So that's why the testing is changing and shifting to certain populations so that we maintain the supplies to do that testing and can make sure that those vulnerable people are dealt with quickly if they are positive.
Mm-hmm. Great. Thank you, Marion. I assume like in the long term, we'd want to increase our capacity to deliver these tests or to take these tests rather in an effective and safe manner. But this is more like the restriction to testing only people with very specific or severe symptoms is really just probably a short-term measure until we can get a handle on things. Am I kind of interpreting that correctly? Because ideally you'd want to be, I would imagine you'd want to be testing everybody that showed any sort of symptom so that that person could be self-isolated or quarantined.
Yeah, and I think we need to also recognize that we need to protect our healthcare workers.
Yeah.
The disease so that they can actually look after the patients who are sick. So the less exposure for everybody, the better. The testing is one way. If we're not over testing people, that's one way to also decrease exposure to the disease.
Right. Okay. Thanks, guys. I appreciate it.
That's a really good point. I'll also say that, shout out to BC Public Health Laboratories, who are working 24/7 on this, literally, and have been really proactively on the testing piece for months now, and are doing their very, very best, and are putting a ton of focus on testing and trying to get as many tested as possible, but there's a limit to what the system can handle right now. And I will say though that like if you look at the very end of these slide decks, I have a couple of awesome visual graphs that show that Canada is 8th in the world right now for testing for across the country, and I think 10th in the world in per million tests. So we're doing a really great job here, I think. And given like what the exceptional circumstance we're in and how challenging it is. Yeah.
Yeah, we can't agree enough. The health professionals that are working around the clock right now in every capacity are doing an amazing job. So quick plug for that as well. Thank you very much.
Next slide, please. So I'll just get into a few key tools to help understand the magnitude of an epidemic, or to understand epidemics and how they're spreading. You might hear people talking about the term R0, which is also called the reproduction number, and it's a mathematical term to understand the contagiousness of disease. R0 tells you how many people will catch a disease from one contagious person. So a key point to remember with R0 is that this number is in relation to the absence of intervention. So if we don't do anything at all to prevent spread, how many people will become sick from one contagious person? It's really important that R0 is very situation specific. It's affected by the properties of the pathogen we're talking about, how infectious it is, how susceptible a population is, maybe due to comorbid conditions or nutritional status, demographics, socioeconomic conditions, etc. We have on the right, there's a graph showing some different R0 values. And the key thing to see here with COVID-19, we have a range that's pretty wide right now, 1.5 to 3.5. And I want to say that the reason why it's so wide is because we're still learning so much about this virus, that we really are in the beginning stages, that there is a ton of uncertainty in understanding the contagiousness of this disease. So whenever you see an R0 value, to take it with a grain of salt and a whole lot of uncertainty. you know, and from what we can tell, that it's between 1 and 4 people per person, which is very broad. It'll be after the fact, after this pandemic is over, that we'll probably get a much better estimate of what the true R naught is. Next slide, please. Another key tool is the case fatality rate, which is how many people die as a result of being infected. On the flip side, this could be also the survival rate if you were to flip things around. But this refers to the proportion of fatal cases amongst people who have a disease, and it provides an index of the deadliness of a particular disease within a specific population. It's important to note that this is very, again, contextual. So it's of a particular context at a particular time in a particular population. So, you know, it's not just dependent on the disease itself, but on the circumstances in which the disease is happening in a population. With adequate interventions, of course, we would want the case fatality rate to be 0. But for some diseases, the case fatality rate is simply much deadlier than others. And this is certainly the case with Ebola. But when you look at something like H1N1 or seasonal influenza, it's a lot lower. For COVID-19, the CFR is still within this sort of broad range because, again, we have so much uncertainty about how deadly this disease is. You know, the numbers that are coming in from different countries are very context specific. So the case fatality rate in China is going to be really different than what it is here. So again, when you see these numbers, to just remember to take them with a grain of salt. There's a lot of uncertainty, and to just, you know, wait until it's all over, and then we'll have a much better idea of what the true case fatality rate is. Next slide, please. It can be really difficult to not feel really afraid and nervous in a time like this, especially, you know, because so much is new and so much is changing every single day. It's really important to be reminded that the vast majority of cases of COVID-19 are very mild, but we do have a number of cases that are severe, and that is very concerning. It's also important to remember that from the data that we're receiving all around the world, that we're seeing that actually 50% of the people who have been infected with COVID-19 have now recovered, and that's really good news. We're also seeing a drop in the number of people who are becoming infected, probably because from China, who has, of course, you know, the first experience with this disease, that the number of new cases there are dropping because their efforts to contain it are really working. And so we'll soon see that kind of rebound in other areas of the world as well. Next slide, please. We know that diseases are caused by pathogens that are viral and bacterial, and I think we all understand sort of how the chain of infection works. But why do clusters of infections blow up into epidemics, and why do epidemics get out of hand and turn into pandemics? You would think that after all this time, you know, humans have great big brains, that we could get a grip on this, but, you know, it seems like there's never-ending waves of new epidemics. And so these are complex questions that have very complex answers. You know, whether we're talking about HIV or chlamydia or H1N1 or COVID-19, there's important factors that are contributing to their spread. You know, especially when we're thinking about the way in which the 21st century lives, it's a lot of dense populations, some big mass displacements of people due to war or other human rights violations. There's a lot more global mobility, both in commerce and just in travel. We have environmental degradation, and then closer contact with animals in the wild, and also with animals that are farmed. So in this era of rapid global change, it seems that many of these factors are almost inevitable. But, you know, if it was just about these factors, I think that we would have had a pretty good grip on things by now. You know, it doesn't really help us explain why there's upwards of 200 events that happen every single year. So we have to look at a deeper level, or at a higher or broader level, depending on how you want to look at it, to understand those root causes and conditions of epidemics. Next slide, please. So perhaps the most important factor to consider in Canada and globally is colonization and how it has manifested in health, social, and justice systems here. Indigenous peoples in Canada have long histories of health and well-being, including traditional healing and wellness practices that have supported individuals, families, communities, and nations. We know that pre-contact there were customary laws regarding hygiene that helped entire communities stay healthy. In addition, there was low population density, intimate knowledge of land and connection to land that contributed to wellness. There was a lot of knowledge around traditional medicines that are still there today that help support health, and also ceremony and access to spiritual practices that support spiritual health, which we know is so important to the health and happiness and well-being of people. And these practices were forcibly disrupted by British, French, and Spanish colonizers. And this quote from the amazing Gwen Phillips from Ktunaxa Nation underscores this view that health is relational. It's about identity, and it's about social responsibility, and it's a way of relating rather than just being about sickness versus health. And I think this is so important because when we're thinking about what contributes to the spread of diseases, whether we're talking about a cluster or a full-scale pandemic, it often reflects our underlying values in how we relate to each other and how we treat each other. The image underneath the quote is from a Kwakwaka'wakw scholar, Dr. Marian Nicholson, and she did a powerful video installation on the often silenced history of the 1862 smallpox epidemic in Victoria, BC. That is part of the collective memories of public health related harms amongst First Nations on the West Coast. This image represents the colonial government and the settler community's betrayal of First Nations people that led to at least 30,000 deaths, where the essentials of vaccinations and other basic health protection measures were not provided. So one case of smallpox erupted into a full-scale epidemic that was devastating. And it's widely believed that this was purposeful genocide and paved the way to settlement of the province. Colonization has been linked to a number of epidemics around the world, including tuberculosis, malaria, and HIV. And it's really important to consider this in all discussions of epidemics affecting Indigenous peoples. Next slide. In addition, we have to consider the interrelated social determinants of health at play for the spread of disease, whether we're talking about HIV or syphilis or COVID-19. These social determinants of health all contribute. I've listed here some of these significant strengths-based determinants that we know are protective against illness, and I'm sure you could think of many, many more. These are very relevant for all peoples and provide the social and systemic foundations for resilience in the face of epidemics. Perhaps one of the most important things that I've learned is the Indigenous paradigm of holism, wherein we acknowledge the fact that everything is related and interconnected, and we can't address diseases in isolation from these foundational social determinants of health factors, and that each nation and its people will have specific knowledge and best practices for addressing epidemics in their communities. Next slide, please. So I'm just going to briefly speak to there was a wonderful report from the NWCPH on pandemic planning in Indigenous communities, and some of the lessons that were learned from the H1N1 pandemic, in BC. I would also say at the start that this is part of, again, another one of the collective memories of public health related harms, that this was not handled that well. But some of the things that were done that did seem to work was like an action plan between governments, coordination between different levels of governments, diagnostic kits being sent out, and mobilization of additional staff, and then a quick response with treatment. You can tell that this is kind of a top-down approach though, this is like really like government coming down, swooping in, and putting in some interventions. If you click the space bar, please. What was learned? So what was learned? So they did a big effort to do some community engagement after H1N1 to find out what was needed in community and what would have worked to really help support First Nations communities. And they included stronger social policies to address those determinants of health, immediate measures to address structural barriers to protection, community level response plans and community-led surveillance, and integrating culture and traditions into pandemic prevention and response. Marian, did you want to say anything on that piece? Yeah, I'm just going to hook up my kid with another cartoon. 1 minute.
Okay. For me, I think it was just really interesting that a lot of the lessons have formed how we are situated and prepared now. For example, there was no Public Health Agency of Canada prior to SARS. And so a lot of new information on how we're managing this pandemic is because of the learnings from previous outbreaks and pandemics that we've had as well. And when you look through the what's learned section on the slide, we do have stronger policies to address social determinants of health since 2009. We do have more immediate measures with those structural barriers. For example, we now have the National Microbiology Lab, which was the start of the testing for COVID. All the communities have community level emergency response plans. There is surveillance happening in each community, and we are working towards the integration of culture and traditions into prevention and response plans. So we have come a long way. We'll have additional learnings from this experience as well. But we are doing a lot of really good work to flatten that curve.
Thanks, Marian.
Thank you, Marian.
Next slide, please. I'll just briefly say, I think that, with this epidemic and many others, that stigma, racism, and discrimination have been key players in the spread of disease. And this again goes back to the importance of being very careful with how we speak about epidemics. Unfortunately, stigma and racism are relevant to around the world, and that they can drive people to hide their illness to avoid discrimination, prevent people from seeking health care when they need it. It can harm businesses and social relationships and contribute to interpersonal violence. So this again is why we need to be very cautious with how we speak about epidemics. Next slide, please. So what we're experiencing now, it's so important to acknowledge, and Nicole, you did this at the beginning, is it's really stressful for a lot of people. And, for people who may already have a high amount of stress in their lives for whatever reason, this can be a really triggering time. And so these suggestions were made by the American CDC and how to support your communities in this time of fear and confusion. Some of the key pieces I thought might be relevant for this talk was to check in on community members who may be struggling, especially older people, younger people as well, people who are living alone, and people who may be using substances or have mental health challenges. These folks might need some extra support at this time. I also think it's important to limit your amount of time you spend on social media and paying attention to COVID news. It's important to stay up to date with good information, but I think it can be pretty overwhelming if we're on it all the time. Prioritize your self-care. Try to keep with your routines, even when we're at home a lot. And our routines are getting very disrupted, but try your best to try to keep up with routines and promote the idea of sticking with routines. Keep to the facts from reputable sources and certainly ask for help. Marian, the next slide is on the ask approach.
Okay, so in the immunization world, we use this quite a bit for communication with our clients that come in to see us, and it's basically you acknowledge your client's concerns, clarify to understand what their needs are, and then you want to steer the conversation. So if somebody is very anxious, you can say, I see that you're really worried about this. Can you tell me exactly what it is that is making you so anxious? And it might have been a story that they heard on the media that was causing some concern for them that's totally unfounded and untrue. So what you want to do is just steer the conversation to correct the information and let them know that, you know, it's okay to feel that way. This is the information on why it's not right, and know your facts well. So we really recommend that you go to extremely reputable websites. The best ones that we've got right now are BC Center for Disease Control, the BC CDC, PHAC, and we've posted on our fnha.ca website. There's information for community members, there's information for healthcare providers, and we've got the links for the reputable sources. There's a lot of scams I think people have heard as well in the media relating to COVID, so just be really, really careful, because the false information, the way that it's framed looks like it's from a credible source, but when you look at it, something might be slightly off with the document or where the information is coming from. So just be really careful, and if in doubt, please check it with a healthcare provider and make sure that you have the right information. The other thing with this, with COVID, is the information is changing so rapidly that it's really difficult to keep up. So what we said last week is now different than what we're saying this week. And so the best thing to do is go to the current links. Don't be printing off a lot of the documents, because as soon as you've printed it, it could be outdated. It's just such a rapidly changing knowledge base for the pandemic.
Next slide.
So again, it's just what you can do to help your community for being prepared, and to stay well is to stay informed with the information and make sure that they are reputable. Support your vulnerable community members. That includes things like social distancing, staying home when you're sick, avoiding other people as much as you can. Stay connected though with like Facebook or whatever you're using, some sort of you know, telephone call, whatever, just to stay connected there. Make sure that people are checking out for you and that you're looking in on people who maybe aren't able to get out and about so much or aren't as connected. Making sure that if people are self-isolating, that they've still got means to food and all of that stuff that they need. And then make sure that people have a little bit of extra stuff. You don't need a lot of extra stuff. The supply chain is still in good standing, so stuff will come in. I know the shops are a little bit low on supplies now, but they will pick up, and you just need a little bit of extra stuff. Next slide. And so in BC, we have a very robust plan. There's a lot of work going on behind the scenes, which I'm not sure that people always see, but our number one goal is to protect the population, and we want to protect our vulnerable people. We also want to protect healthcare workers and support our healthcare capacity. So we've spoken to a lot of these things, but you can kind of see, looking back in the last couple of weeks, the different disease control measures have been put in place so that we are responding appropriately and at the right time with specific implementation of these items. And it does feel like it is a bit restrictive, or it can feel that way, but it is really important that it's just for a short time. We don't know exactly the end date on it. And in a way, we want it to be a little bit longer than on the short side, because then we know we're flattening that curve as well. So everybody is working hard for the same end goal. Next slide. Again, I was mentioning the PHAC, or Public Health Agency of Canada Resources. There's many, many on coronavirus there. There's some posters for community, for health centers, what you can do to be prepared. So just feel free to take a look at that website and look through the posters and the information there. It is a very credible resource for you.
They have really great infographics too. They're like really accessible, and some really good information for Indigenous communities, and actually some public service announcements in Indigenous languages. And I've seen that they are intending on building more content in that section of the website. And there's a really amazing video as well with some Indigenous leadership talking about First Nations preparations.
Yeah, and keep checking often, because things are added daily.
For sure. I think these resources just came up, I want to say yesterday.
Yeah, yeah, some of them. So
They're brand new, yeah, and they're pretty nice, and they're very comprehensive. So next slide, we'll just go through, the next few slides are just lists of different resources that you might find really helpful. And the information for Indigenous communities link is at the very top, as well as the information in Indigenous languages. There's BC specific information from BC CDC. It's very comprehensive as well. Vancouver Coastal Health also has a regional pandemic response plan. And there are the other Public Health Association of Canada fact sheets. Next slide. There are also a number of free toolkits and public health emergency response plans that have things like checklists and things to think about that might be helpful for your community. If you're interested in global health resources, there are also some very interesting training resources online. Next slide. If there are people in your community who use substances who might need some extra support, there are some really wonderful harm reduction materials during COVID-19 that are out. The one at the top there is a brand new one that's been just put out by BC CDC. Also harmreduction.org has some wonderful resources. And there are two brand new Twitter feeds. They're listed at the bottom. That have some sort of live updates and helpful information and support offered. Next slide. There are also a number of new materials out there on supporting the mental health of people, of yourself and people in your community during this time. Anxiety Canada has some really good advice, and the World Health Organization and the World Economic Forum. Next slide. And finally, if this is a really interesting topic to you, there are some really, really great short courses in epidemiology and emergency response that are out there offered. That first link has like over 200 links to different free online courses. And the bottom one is a link to a Harvard online course. If you ever wanted to get a Harvard education, there's a link there at the bottom for a free course. And this was just what I referred to earlier on about the number of tests being performed by country. And you can see Canada there is listed as number 8. And this was updated just on Tuesday. And we're really trying to keep up with demand here, and doing a pretty good job. So I think now is a good time, hey Marion, to go to questions.
Yeah, that sounds like a great idea. We do have a few questions from community, as long as you guys are ready and willing.
You bet.
Awesome. So I think there's a few questions here, and I think I'm going to try and kind of bulk them up into one question. And before I ask it, I want to reiterate again that a lot of information that we might be asking in this Q&A is really important for you to know, but always be aware that, like Margot and Marion have reiterated several times, that the information that it's an ongoing, it's a fluid situation, and that the responses might be different depending on kind of when you ask those questions. I think particularly for Corona, we've seen it go through a couple different. There have been some changes to some specifics of the disease, but I think this one is pretty safe. We have somebody asking a question about spread, how they can contract COVID, and they're talking about their ears specifically. But I was wondering if you guys could just briefly kind of go over how does COVID transmit from person to person?
So it's droplet spread. So that means if it's on hands and you touch a doorknob, somebody else touches the doorknob, and then you scratch your face, it goes into your mucosal membranes, like your mouth, your eyes, your nose, and that's how it's spread. And so that's why you've heard so many times how important it is to wash your hands. It's because we're not typically the cleanest people necessarily, and I think it's left over everywhere. I don't know if anyone saw the Office Kitchen on CBC TV, and they showed all the fingerprints on all the coffee machines and all that stuff. And it's just kind of yucky. So I think you know, washing your hands, because again, we also are creatures of habit. We like to touch our faces a lot, and we seem to not be able to stop it. We shake hands when we meet and how we greet people. And so those are ways that carry the virus and then transmit it into ourselves. It can last on surfaces for up to several hours, I believe, and more information is coming on that as well. But essentially it's droplet spread through touching a contaminated surface and then getting it into your system. You know, not washing hands before you eat something as well.
Mm-hmm. Okay, great. Yeah, my next question was going to be about the surfaces. So I think if we just adhere to really strict and very safe hand washing techniques, then it shouldn't be too much of an issue. Yeah.
Sorry, can you repeat that?
My next question was going to be about surfaces, but it seems like the information is changing quite a bit. So if we just stick to washing your hands safely for about 20 seconds, is that correct? Am I right in that? For about 20 seconds at a time?
Make it 30, make it 30 just to be sure.
Make it 30 just to be sure, and make sure that you're doing it often.
Yeah.
And that should be
and soap and water is still the best way to clean your hands, and just making sure that you're remembering to get under your fingernails and your thumbs up to your wrists. But liquid soap and water is still the preferred way. If that's not available, then hand sanitizer is the second line of defense. If possible, if your hands are really dirty, if you can kind of wipe off the dirt first, if you don't have any soap and water, and then use the hand sanitizer.
Okay, great. Thank you, Marion. I heard I had heard that that soap and water was best. So thanks for clarifying that. I appreciate it. We do have another question. It's more related to well-being, I suppose. Do you guys have any suggestions as to how we can all stay well and connected with others while we're in this period of self-isolation? I imagine there'd be some resources, or there's obviously those resources that you just shared, the websites, but do you two have any personal advice for that?
I think, again, it's just sticking to your routine as much as possible, trying to not follow too many COVID channels and things, and just, you know, take them with a grain of salt, because there's a lot of information. It's the only thing that's being portrayed on the news channels and things right now as well. That's what's happening, particularly because everybody is in their house. So, you know, if you're not symptomatic and you're feeling well, if you can get outside, maintain that social distancing. Fresh air is always a good idea. If you are sick, it's, you know, get some good books, do some puzzles, have some family time, do things that you haven't done in a long time with your family, that kind of stuff. And definitely the FaceTime, texting, that sort of stuff is still okay, but definitely limit social gathering as much as possible.
Yeah.
Oh, sorry, go ahead.
Sorry, Cole. No, please go ahead.
I was just going to say thanks very much for bringing up the fresh air part. I think that some people that I've talked to kind of seem to confuse self-isolation with like isolating themselves in their house. And I go out 3 or 4 times a day with my dog. We just go running or walking in the woods. There's nobody else around. I'm not in contact with anyone else, but it's nice to get that change of scenery, a little bit of fresh air and some sunlight. And obviously run my dog around so he doesn't drive me insane while I'm isolating.
Exercise is a good thing to maintain as well. Some sort of exercise, physical activity, be it inside or outside.
No doubt. I would just add that, like, I'm a self-professed really sensitive person, and so taking care of my emotional health and my mental health is really important. And so you know, spending a bit more time connecting spiritually is important to me. Keeping up with that kind of health work has been really, really helpful as well, just to instill feelings of calm and connection spiritually can be really, really helpful as well.
I think it'll start getting to be interesting as well to watch what's going on in China and some of the places that their peak is over and it's going down. I think yesterday I saw that China didn't report any more cases. So for me, there's hope in that as well, that we will get through it.
Absolutely.
Yeah, for sure. I think it would probably, we had an earlier question related to the time length of a curve, and obviously we can't really know what that's going to look like at all, but I would imagine it would be different. As we spoke about, it's population dependent. So that China is not reporting any cases. They had, I would imagine that their spike was quite a bit more pronounced than what we're shooting for, right? So our curve is, or the time in which we hope to kind of navigate this time, or this situation would be quite a bit longer, hopefully, so that it doesn't become as severe. Is that correct?
That's absolutely correct. Yeah.
Great.
China, unfortunately, got hit, blindsided really by this, and had to really scramble to try and keep up. They have a much more, it was happening in a very densely populated area as well. But, they worked with such efficiency on the problem, and they're really coming ahead of it now and are able to actually help other countries, which is amazing and really good news. So yeah, at this point, there's so little known about how it's going to play out here. And so it's really hard to say how long this curve is going to last for. I think that, like, with the amount of, I'm really heartened by the amount of effort and dedication and commitment to the public health measures that are being suggested, like social distancing and such like that. That I think that, we're doing a really good job as a community here, and we just have to keep at it.
Yeah, absolutely. Thank you. So we had another question, which I think is really critical for us to address here. I've heard mixed feedback around wearing gloves and masks. Do you have any information on whether that helps or not?
It's Marion here. I think, yeah, it depends on who you are and in what context. So for the general public, to prevent yourself from getting sick, the masks are not going to help. The masks are more for preventing spread of disease. So if you are symptomatic and you're going into the hospital, then we would ask that, if possible, that you're covering your mouth and stuff, and that the masks are used by the healthcare providers who are looking after you to reduce those. But for everybody to be wearing masks, it's not going to be effective. Gloves are also tricky in that it depends what kind of glove they are, and as well as how you're taking them off. So if they're contaminated and you're not using proper technique, you will you'll not dispose of them correctly, and there'll be more virus around. So that's where the hand washing is, that you can, that's the guarantee that if you're scrubbing your hands as directed with regular soap and water, that is the best way. So gloves are not going to be 100% either.
Great. Yeah, thanks very much for addressing the spread with the masks. I know a little while ago, I had read anyway, that a little while ago we were experiencing a bit of a shortage for certain supplies like masks, because people were buying them. And obviously more recently, within the last week or two, we know a lot of people are buying toilet paper for whatever reason. So I think that's also like a critical piece in talking through a lot of this stuff, is that social responsibility. If we don't need to be buying out every supply of masks that we can find, or every glove, or every toilet paper, or every jug of milk, then we probably should be avoiding doing that. Would you agree?
Yeah, absolutely. I think if everybody does it, there is just not enough, and it's a global issue that every country is looking for all of these the masks and gloves and proper protective equipment for their staff. And we really need to be mindful of that, because if we don't have healthcare workers to look after folks, we're in bigger trouble.
Excellent.
I think everybody can do their part, and washing hands is extremely effective.
Yeah, thank you. Margot, did you have anything to add to that, or Marion kind of hit the nail on the head?
Oh yeah, I think the nurse hit it on the head for sure.
Awesome. So then we have another interesting question here, which is, how can we best support healthcare workers in our community? I've heard amazing stories of people in the US organizing campaigns to have meals delivered to healthcare workers. And are either of you aware of any campaigns that exist like this in BC or Canada?
I'm sure there's lots. I know communities are really pulling together to look after one another. I think the biggest thing is, reduce the spread, social distancing, washing our hands, staying home, You know, if you've got mild symptoms, absolutely staying home. If you've got severe symptoms, you need to come to the hospital, but we need to keep the flatten that curve so that our healthcare workers can manage the surge and support that surge capacity. So that's really the best you can do, is just make sure that we're doing what we can to keep people out of the hospital and preserve our healthcare workers that way.
Mm-hmm.
It's such a good question, and I think also to support people in your community who might need a little extra help will help everyone too. Yeah.
Yeah, absolutely. I think that really drives home the point that, you know, when we're faced with a situation like this that's affecting entire communities, it really is a joint effort. Healthcare workers are on the front lines. They're doing work. They're invaluable work. Can't stress that enough, but it's up to all of us to do our part to make sure that it's as manageable as possible, right? So actually kind of building off of that piece that you mentioned, Marion, about the severity of symptoms, we have a question for those with recent lung issues and are having difficulty breathing or coughing. So this was before COVID, mind you. When is the appropriate time to go and see a doctor? In other words, how can we distinguish the differences between a flu and cold and COVID, particularly as it relates to breathing difficulties for those individuals that may have had that before COVID, right? How do you recognize that difference?
Yeah, it is very tricky, and absolutely, if you're having shortness of breath, difficulty breathing, those are emergency situations no matter what the cause. So you do need to seek help at that point. You can let the first responders, or however you're getting to the physician office, and as well as your care provider's office, that you are having respiratory symptoms, so that they can take the necessary precautions before you come. So things like emptying out the waiting room is all stuff that can be done as well, but absolutely don't wait to seek help if you're having breathing issues and stuff. You need to be seen.
Great.
There's also on that PHAC website with all the new fact sheets and that, there is a fact sheet on self-monitoring. So if you're a little bit concerned, it's like how to keep track of your symptoms, and so that you like have a really clear idea of what you're experiencing, and so you know yourself, you know when things are getting to a level that is unsafe, and to take yourself in to get help for sure.
There's also the line, I don't have it off the top of my head, but on the 811 website, there's a symptom checker that you can run through online, and it will tell you as well what you need to do and when you need to seek further help. And that is also to help slow down the call volumes at 811, so that those that do need immediate access will be served faster.
Great. Thank you. Thank you both very much. So we had the questions are just pouring in at this point. So try and get through as many of them as we can. Any thoughts on restricting travel to remote and or northern Indigenous communities in Canada? The individuals heard of travel restrictions to Nunavut taking place. Should we be thinking of the same thing for northern BC communities? I think I read in the news that there was a blockade of some kind for the western Vancouver Island. I don't know if that was true. It's all in the case, or it's all in the effort, I would imagine, to protect those isolated communities. But what are your thoughts on it?
I think the restrictions to travel are more of a governmental decision than, from my perspective. Like, I can't say for travel restrictions and stuff, and I think they're watching to see what's going on with it. But again, if people are sick, they really shouldn't be moving about the province so much. So you know, I think that we've done the international borders and things, but right now across the country, there's still flights going, domestic flights and things like that. We still need to maintain some sort of transportation system for families, as well as to get supplies into communities, to get nursing into communities, to support the community. So as much as we want to kind of hunker down and put walls around us, we have to probably have a couple walls still down, so that we can keep the supply chains going.
Yeah, I would just add that, like, Indigenous leadership knows, you know, have been working really hard and knows what's best for their own communities, and you know, that they're taking sometimes those extra precautions just to be absolutely sure to protect their community members.
Yeah, absolutely. I know similarly, to pull on an example from the center here, we were scheduled to go to Gathering Our Voices, which is a youth kind of gathering for students, and that was canceled by the organizers, by the community, just to preserve the health of all of those that will be attending. I think, and I think we can just continue to take or follow the lead that is being set by that leadership. Thank you for your thoughts very much, both of you. So now we're kind of coming back down to some, this one's a little bit more of a social question, I guess. So I'm interested to hear your responses. Do you have any advice for talking to older relatives or individuals that are at higher risk, but they don't seem to be taking social distancing very seriously? The participant in particular says that their grandma won't stop going to Costco for some reason. So what are your thoughts on that?
It's a good question. I think, you know, it's a habit that we all need to change, because we are very social creatures. And so we like to be close with other people and, you know, have the social gatherings and stuff. And I think that it's just, things are evolving so quickly that I'm not sure that everybody kind of sees yet what it is and what your personal risk is to the disease as well. And so I think it'll also take a few more days until we see the positive impact that the social distancing and things like that is having, right? Because it's a up to 14-day incubation period. So what we start today, we're not going to see it immediately, but we want to see those signs, and hopefully people will start to understand that it's, you know, for their own personal good, but as well as that of their community and their friends, because we don't want to be the person who spread, you know, disease into our families and that sort of thing through no fault of our own. It's just the way it is. But it is difficult, and it is definitely life-changing, and there's more changes coming, I think, that we'll see as well. And it's just, we're going to have to adapt and do it for at least a short time, and time will tell where things go with it.
That was very well put, Marian. Thank you. Margot, did you have anything to add?
Sorry. I guess I would just say, you know, that, you know, speaking to people about social distancing can be really tough when they're, you know, like feeling afraid and wanting to get out there and get enough supplies and such like that, like, because there is a lot of fear. And so if, I think, you know, what Marian was talking about around the ask approach is like acknowledge and say, yeah, I get it. Like, this is a scary time. I understand why you feel the need to get out there and get stuff, or like, you know, you want to keep up with routine because it's overwhelming not to. And so, you know, just acknowledge and then just reiterate that this is a really different time. And, you know, we're all just going to take some extra measures to protect each other. And I want you to be safe, and, you know, how can I support you to do that? So kind of taking an approach of compassion and understanding, I think, goes a long way.
Great. Thank you. Thank you both very much. So we have another question here. Firstly, do you know of any online support groups in the community that youth or others can join to get social connection and emotional support? They're speaking from their context, of course, but they said that on campus, loneliness is a huge issue, and having a safe space to connect with others is very important to their well-being. And if you two don't mind, I might take a quick swing at this one, just sharing some resources that I'm aware of. And this is kind of just a personal thing, but one of my pastimes is to play Dungeons and Dragons or role-playing games. For those people that are aware of what that is, it's just you just roll dice and you have fun with friends. The implication of that, unfortunately, is that those are done in person, right? You meet up at a table and you roll dice and kind of collaboratively tell a story together. It's tons of fun, but it requires close proximity to other people. So my social group has made the decision to join, to continue to have that, to continue to host the game, but to move it to an online space, actually very similar to what we're doing here. So so that we can continue to engage in an activity to keep up those routines, as Margot and Marion mentioned, and to have some social connection with one another. I think if I could offer any advice, it would be that if you're looking at supporting each other over an online space, trying to center it around an activity that you guys can do together, whoever it is, or the youth can do together, whether that be an online role-playing game. That might not be everybody's thing, but it could also just be getting together and sharing a coffee over Zoom or something. I think it's critical, even just having those regular scheduled events. So I agree. I think it's really important to look for that connection. Margot, Marion, do you guys have anything to add or correct?
Yeah, no, I agree. And I think we're starting to see more and more information coming out for emotional wellness support around COVID. And it's starting to trickle out on the websites and things like that. And the existing resources that you have will be shifting how they do their services as well, but they're still there to support. So everybody is still working, maybe from home, but they're not shut. They haven't closed the services.
Mm-hmm. Margaret, did you have anything to add, or did we kind of get it?
I think that you guys really got it. Absolutely. I was just sort of thinking that, sometimes it's not easy to get online for some people. And, we're all online here today. So, those of us who do have a good connection are here. But I think this is a time of community, that relational wellness piece is starting to think about people in your community who might need someone to reach out to them. So, picking up the phone and calling, or, sending a postcard or something to let people know that they're cared about and you're thinking about them, I think can go a long way as well if connectivity to the internet is an issue.
Thank you very much for that, Margot. I think that leads really nicely into another question we have. Do you have any thoughts on how people experiencing housing insecurity or homelessness can protect their health when they are not able to self-isolate? What are you guys' thoughts on that?
That is such a critical issue that is on a lot of people's minds right now. How do you self-isolate when you're living in a SRO, or when you're, unable to, if you don't have stable housing, or your housing situation isn't safe? These are ongoing questions that need, I think, more work. Again, there are in that PHAC list of resources, there is really good information on how to support people who are marginally housed or homeless. Also in the harm reduction, that list of harm reduction resources, there's also some really good advice in those resources as well. Marion, do you have anything to add?
Yeah, I think there's a lot of work being done to see how to best support the most vulnerable populations, including homeless, and what can happen with the shelters and things like that. So there is definitely work being done behind the scenes, and more information I think will be coming out in the coming days on that as well.
Yeah, absolutely.
Great. Thank you both very much. So we actually have a contribution from a community member. Lena says, Indigenous educators are volunteering their time to help educate students online, and they've provided a link to that. So I think if you were looking for something for youth to connect over in an online space, that might be a good resource to check out. Lena also has a question though that I think is critical here. How much risk is there to others from asymptomatic carriers of COVID? So if you're not coughing out the droplets that Marion, that you mentioned, what is the risk of those individuals in spreading the?
Yeah, we don't know yet.
Okay.
I think at this point the thought is that they're not spreading as much virus as somebody who has symptoms. But can we say that they're not spreading disease at all at this point? I don't believe we can, which is why we're saying the social distancing and the good hand washing and those sorts of public health measures.
Right. Yeah. So better be safe than sorry in this instance.
Exactly.
Right. Margot, did you have anything further to add?
No, that's exactly the thing. We don't know enough about COVID-19 yet to know how much asymptomatic people are contagious. So yeah, social distancing for now until we have a much better understanding.
Great. So we have another question here that's about kind of receiving packages, and I think it could extend very broadly to just objects that you go and buy in a store, right? If you picked up something from the shelves or what have you, the individual is asking whether or not they should disinfect those items. What are your guys' thoughts on that?
I haven't heard that you have to disinfect those items, but I think it's making sure that your counters, I'm assuming these are groceries, so food prep and stuff, that you're washing your hands before you're touching your food.
Yeah.
I think there's some thought that cooking it is also, best case scenario if you're cooking the food because of the cleanliness. So definitely, if you've got fruits and vegetables, make sure you're washing them as well. It's just all hygiene practices, which we all tend to probably need a little bit of a tweak on how we handle our food. Anyway, I think that it's not carried on food necessarily on the packages themselves. It's depending on who else has touched the packages and how long ago.
Great. Thank you. Margot, did you have anything further to add?
Nope.
No? Okay. So we're coming down to the end of our time here, so I'm just going to do our Learning Circle outro, a couple plugs. But if you have any last minute questions for Margot or Marion, please feel free to populate the chat box and we'll try and get to them. So as you may have read on our website, most of the Learning Circle sessions have been either have been rescheduled due to the ongoing situation that's happening. People are unsure of kind of where they're going to be, or often their workload shifts. I'm sure that a lot of the educators out there can empathize with this, but it's not a simple process to just move all of your curriculum online. So many people have had to reschedule, but we're at the Learning Circle, we're working hard to try to get our schedule re-updated and reconfirmed, and it can be found on the website there. In the absence of those, though, I'd like to make a quick plug to remind everybody the Learning Circle is online. It's on YouTube. So if there's a session in the past that you missed out on, or perhaps you're looking for a break from Netflix for the hours that you're in self-isolation, please feel free to check out our YouTube channel. It has many different informational sessions on a wide variety of topics that I think are really great, and a good way to pass time in an educational way. Just checking. Oh, we do have another question. Okay, I heard viruses spread easily through children. Does this also imply to my pets? Are you aware of COVID being able to be carried through pets at all? Does anybody know?
I think there's still studies being done on it to see what the impact is. I think at the beginning there was questions on where did this novel virus stem from? Was it from an animal transmission? I don't believe that there's a lot of transmission, but again, I think it's still safe, hand washing after you've played with your pet, kind of thing.
Okay, great, awesome, thank you.
Sorry, one more thing on that.
Yeah, sorry, Margot, of course.
That's okay, no worries. So there is a little bit of recent information on that, and the information is they don't know, and that if you are ill with COVID-19 and you're in self-quarantine, to perhaps stay away from the family pet or ask somebody else to take care of your pet, just in case, because they're still trying to find out more about whether or not pets can carry the virus. And as for children, I think that they're finding that the vast majority of children who become ill with COVID-19 have very, very mild symptoms. So you might not realize that they have COVID-19, and perhaps that is the reason why, people are feeling like they might have exposure to children who are sick, might be spreading the disease. Marianne, am I right about that?
Yeah, it's
okay.
They're much more milder symptoms, and
Yeah.
they're not necessarily, you know, depending on the age, they're not that great at putting tissues in the garbage and washing their hands very well and all that stuff. So the thought is that they can be probably good transmitters. And spring break is a popular time for elders and grandparents to be looking after children. So I think it's just, you know, let's jump on this now while we can and separate them out a little bit.
Yeah.
Great point. Keep in mind too, one more thing to keep in mind is that we're in an influenza season already, a seasonal influenza, which is really regular for where we live and this time of year. And so there's a lot of people who are having flu symptoms right now who are just sick with flu, which is a great reason to stay at home as well. So, you know, if you have a scratchy throat or, you know, stuffy nose and such like that, like just stay home. It's worth it just to keep the amount of virus from any illness that's out there out of the community.
Absolutely.
I just make a comment as well that we talked about a lot of things that people shouldn't be doing right now, but still a lot of things that you can do. So focus on the things that you can do. There's still a lot of fun to be had. We just need to minimize a few things that we tend to do that maybe aren't as helpful right now.
Oh.
Yeah, absolutely. I couldn't agree more. I'm looking forward to my Skype Dungeons and Dragons session. I think that's gonna be tons of fun. So I encourage all of you to find whatever it is that works for you in finding that enjoyment wherever it may be. So I also wanted to take a second here now that we're kind of to the end of our session. Margot, Marion, I feel like I'm missing out and not being able to be with you right now, and to thank you very much in person for all of the work that you've done in pulling the session together so quickly. Margot, especially, like a huge shout out. You've been a massive help to us at the Learning Circle in making sure that we bring this topic to our interested community members. Marion, I can't thank you enough for your time and your expertise. Both of you, sincerely, thank you so much. I appreciate it.
It's an absolute honor. Thank you for asking us, Cole. Thank you.
And so with that, I think it's time for us to log off. Yeah, so just make sure that you're taking care of each other. Stay well, please. Self-isolate, and please wash your hands. And we'll see you next time.